Good morning, everyone. We welcome you all to the webinar on careers in clinical psychology, professional education, RCA registration, employment, self-employment, and global career opportunities, organized by Department of Clinical Psychology, Helen Keller Institute of Research and Rehabilitation for Disabled Children, Hyderabad, which is affiliated to Osmania University and approved by Rehabilitation Council of India, New Delhi. Today, we are here for the webinar on clinical psychology from student to mental health professional, how the journey proceeds. Under this, the objectives of today's session is to understand what clinical psychology is, know the educational pathways from intermediate to becoming a clinical psychologist, understanding RCA approved professional courses, learn more about RCA registration and licensing, and explore employment opportunities in India and abroad, understand entrepreneurship opportunities, and learn future trends in mental health professions. Now, why clinical psychology? As per the current situation, mental health is becoming one of the fastest growing healthcare sectors globally due to lifestyle and influence of various cultures, media, increasing demand because of stress, anxiety, depression, developmental disabilities, learning disabilities, intellectual disabilities, neurodevelopmental disorders, geriatric mental health, workplace mental health, school mental health, digital addiction, and substance use disorders, and various other reasons. The World Health Organization estimates that 1 in 8 people worldwide lives with a mental disorder, highlighting the growing need for trained mental health professionals. As per the statistics, we do not even have one clinical psychologist per 1 lakh population. That creates a huge gap and also a huge potential and demand for mental health professionals. Now, what is clinical psychology? Clinical psychology is a professional discipline concerned with psychological assessment, diagnosis, prevention, psychotherapy, rehabilitation, behavior modification, counseling, crisis intervention, mental health promotion, and many others, including clinical psychologists who work with children, adolescents, adults, families, and older adults across healthcare, education, and community settings. Now, how do we become a clinical psychologist? After intermediate, the educational pathways are like in intermediate with BPC and MPC subjects. One can opt for BSc Clinical Psychology Honors. This is Bachelor's in Clinical Psychology Honors course, which is for 4 years divided into 8 semesters, which includes various subjects, papers like general psychology, developmental psychology, biological psychology, cognitive psychology, statistics, psychological assessment, psychopathology, counseling, research methods, clinical practicals, and students also receive extensive practical exposure through hospitals, rehabilitation centers, and community programs, along with other placement services in clinical, community, and rehabilitation settings. So, after completing your bachelor's in clinical psychology, you can pursue master's in clinical psychology and further register yourself as a clinical psychologist with RCA registration as a licensed clinical psychologist. As part of further education, you can also pursue doctoral programs and then postdoctoral programs in clinical psychology and take up teaching, research, or private practice. So, what is RCA and what is its importance? RCA, in short, Rehabilitation Council of India is a statutory body established by the Government of India which regulates rehabilitation education, standardizes professional training, maintains the Central Rehabilitation Register, grants professional registration, protects the public by ensuring qualified professionals provide rehabilitation services. Why RCA registration? Without RCA registration, professional practice may be restricted for regulated rehabilitation professions which are strictly or independently recognized and designated for rehabilitation process. And also, eligibility for many government positions may not be available due to lack of RCA registration. And also, registration is open, often required in RCA regulated rehabilitation services. The benefits include professional recognition and government employment eligibility, legal professional identity, nationwide recognition, and even at state and district level, and continuing professional development opportunities through CRE programs. Professional skills developed as part of this clinical training or through these bachelors in clinical psychology include psychological testing, IQ assessment, personality assessment, neuropsychological screening, behavior assessment, counseling skills, cognitive behavior therapy, family therapy, child guidance, crisis counseling, evaluation and report writing, case documentation, research skills, and furthermore, many more skills that will be developed as part of this training process. Apart from this, there are various employment opportunities in government sector, private sector, and also across the world. Coming to government sector, All India Institute of Medical Sciences, AIMS, NIMHANS, central government hospitals, state government hospitals, district mental health programs, medical colleges, rehabilitation centers, government schools, special schools, child development centers, national institutes, armed forces hospitals, railways, defense hospitals, police departments, prisons, juvenile homes are just few places where you can find your employment in government sector. In private sector, we see multi-specialty hospitals, corporate hospitals, mental health clinics, rehabilitation centers, child guidance clinics, autism centers, de-addiction centers, NGOs, universities, colleges, research institutes, corporate wellness programs, employee assistance programs are few opportunities where you can find employment in corporate sector and private sector. And there are various emerging areas in clinical psychology and sectors, and there is also an increasing demand in telemental health, online counseling, digital mental health platforms, artificial intelligence in mental health, school wellness program, geriatric care, pain management, oncology, psychology, palliative care, hospice care, sports psychology, aviation psychology, animal psychology, disaster management, military mental health, occupational health, workplace wellness, and many. There are also self-employment opportunities after completing your bachelor's and master's as an assistant or as an independent clinical psychologist. Clinical psychology graduates can establish psychological counseling center, child development center, learning disability clinic, autism intervention center, behavior therapy center, family counseling center, career guidance center, rehabilitation center, telecounseling services, corporate wellness consultancy, school mental health consultancy, and also various other opportunities like psychological assessment services, internship training centers, continuing education programs, community mental health projects, CSR mental health initiatives, and so on. Coming to entrepreneurship opportunities, there are various possible ventures and potential like mental health startups, like digital therapy platforms, mental health apps, telepsychology services, AI mental health solutions, including education and related verticals like coaching institute, professional training, skill development centers, and also in healthcare industry, in multidisciplinary clinics, rehabilitation centers, child development centers, in research domain, in research consultancies, data analysis, clinical trials, and also in corporates, in employee wellness services, leadership coaching, organizational behavior consultancy, and so on. Apart from local, state level, regional, and national opportunities, clinical psychologists or clinical psychology graduates has international career opportunities in countries such as US, UK, Australia, Canada, New Zealand, Ireland, UAE, Qatar, Singapore, and many other countries across the world. Career pathways abroad depend on each country's licensing, registration, and immigration requirements. Additional qualifications, supervised practice, credential evaluation, or local licensing examinations may be required based on country requirements. Employment settings include in abroad hospitals, universities, rehabilitation centers, schools, research institutes, community mental health services, NGOs, private clinics, and so on. Coming to salary prospectus, though the salary ranges and depends on the skill sets, qualification, experience, and also the willingness to extend services beyond traditional roles. So, approximate ranges vary by these factors like qualification, employer experience, location, and so on. So, entry level professionals on an average earn 3 to 6 lakhs per annum. Experienced professionals earn 6 to 12 lakh per annum, and senior consultants and specialists earn on an average 6 12 lakh per annum and above. So successful private practitioners and entrepreneurs may earn substantially more depending on client base and services. There are psychologists who are earning even more. So it all depends on the skill sets, qualification, and also the art and science of delivering the services through professional code of conduct. Internationally, also income varies considerably across countries based on licensing requirements, qualifications, healthcare systems, and experience. Licensed clinical psychologists in countries such as US, UK, Australia, Canada generally command competitive professional salaries at par with other health and medical industries. Now, clinical psychology has a bright future, growing demand in AI assisted mental health care, digital therapeutics, virtual reality therapy, neuropsychology, patient mental health, child and adolescent mental health, aging and dementia care, rehabilitation psychology, public mental health, community based rehabilitation, and so on. Now, where do you pursue bachelor's and master's in clinical psychology? Now, there are various RCA registered organizations available across India, and as this webinar has been created and delivered today to provide opportunity also, there are many times we hear the opportunities, but we are not properly guided where we can pursue those opportunities. So, why choose HKIRRDC, Helen Keller Institute? It has 40 years of service in education and rehabilitation with a proven record of 4 decades, affiliated to Osmania University and RCI approved professional programs, experienced faculty, clinical exposure, hospital training, rehabilitation training, and research opportunities as part of education, and also various research projects and community outreach programs, including awareness programs, mental health screening programs, and various other programs organized in the community, and also industry interaction and corporate wellness programs, career guidance, and placement support, which is strong as proven record. Now, how do you take admission? Bachelor's in Clinical Psychology, honors course is of 4 years duration, and the eligibility is intermediate with BIPC or MPC with prescribed minimum qualifying marks as noted for the admissions, including applicable relaxation for reserved categories according to the current university and government regulations, which is around 50% of the marks to be scored. Students should verify the latest admission notification issued by Usmania University and Helen Keller Institute for eligibility criteria and seat availability, which has been shared, which will be shared with you all through email. So finally, we have seen that clinical psychology is a rapidly growing healthcare profession, and professional education provides a strong scientific and clinical foundations. RCA recognized qualifications which are essential for regulated rehabilitation practice in India, where applicable, which is a wonderful opportunity to work in rehabilitation services. This also provides diverse career opportunities existing in healthcare, education, rehabilitation, research, and corporate sectors. Entrepreneurship and digital mental health are also expanding avenues for professionals in this digital era. International careers are achievable with country specific licensing and credential recognition with basic qualifications after completing bachelor's and master's in clinical psychology. Now the forum is open for any queries. Those who are interested, you can raise your hand or use your chat box for any queries. Okay, let's take few queries. So which psychology course should I choose after intermediate? If you are planning to work in non-clinical settings and non-rehabilitation settings like schools or in corporate wellness programs or similar settings, so it is advisable to go with clinical psychology because that will give the both the clinical settings, rehabilitation settings, and also the general settings. But if you want to restrict yourself to general psychology, you can pursue general psychology course, or if you are planning to work in clinical or rehabilitation settings, this course, Bachelor's in Clinical Psychology, would be the right course. So, yes, what is the difference between psychology, clinical psychology, or rehabilitation psychology, or psychiatry? Yes. See, psychology, where you have to treat your clients with therapies and interventions. You cannot prescribe medications. Psychiatry is where doctors, medical doctors, they prescribe medicines, psychotic drugs for the clients or the patients. So that is a major difference between psychology and psychiatry, where here we focus on mental health and psychiatry majorly focus on mental illness, which has to be cured with medication along with therapy and interventions. So psychiatrists and psychologists work together. And coming to clinical psychology, as already informed, if you are planning to work in hospitals or rehabilitation centers and clinics, so Clinical psychology provides you adequate training, qualification, and eligibility to work in clinical settings. Is our RCA registration mandatory? Yes. As I have said, if you have to work in clinical settings or rehabilitation settings, so RCA registration makes mandatory for the intended career path, and also to be recognized as a registered professional and also to be eligible for government jobs. The job opportunities after graduation, you can you will be recognized once registered as a clinical psychology assistant after bachelor's, and after master's, you can register yourself as an independent clinical psychologist. And we also discussed various job opportunities. Yes. Can I start my own clinic? Yes. Under supervision of clinical psychologist. If you have completed bachelor's, you can start your own clinic. Or once you complete your master's, you can also have your own clinic and have uh, students or interns or employees who have completed bachelor's in clinical psychology and also master's and with other qualifications in clinical psychology. Feel free to share your suggestions and comments if any queries. We have provided contact numbers for the admissions. You can connect to office for further details, and admissions are in progress. So as early as possible, you can utilize this opportunity to enroll yourself into bachelor's in clinical psychology. Yes, what higher education options are available after BSc clinical psychology? As already mentioned, you after bachelor's, you can also pursue masters and then doctoral programs and doctoral programs in India and also abroad. I think with this, I can stop here and take some more queries. I request everyone to share your details in the chat box for attendance certificates, your full name as you have registered, and your designation, organization, the place, along with your email and phone number, all in one message. Anupriya, if I want to work as a psychologist in crime branch, it is possible. What is the process? Yes. After completing your clinical psychology, you can work in anywhere, in any settings. If interested, you can also pursue specialized courses like forensic psychology, criminal psychology, which will help you to understand the settings. Otherwise, also through experience, you can gain. Yes, you can work as a psychologist in abroad. It depends from country to country, which country you are planning to visit. Every country has its own licensing provisions where you have to take a test from the respective country. Yeah, you are doing BA honors psychology, HP Ayush Chaturvedi. Okay. So is that course recognized by RCA? There are courses which are recognized by RCA, which are not recognized by RCA. So if you are doing a course which is not recognized by RCA, still you can find some opportunities like through additional qualifications. There might be a bridge course coming up soon, which will provide you an opportunity for you to join, courses which are RCA recognized. Otherwise, also in general psychology settings, you have multiple opportunities. No need to worry. Not everyone will be willing to work in clinical settings. So, apart from clinical settings, more opportunities are there in community settings, right? In other school settings, educational settings. Okay, AR Rutresh. I want to be a psychologist at schools. So, you can take up this course. This will also bachelor's in clinical psychology or bachelor's in general psychology. That will help you to work in schools, colleges, and universities. But it's always better because when you study clinical psychology, it provides more opportunities. It gives you plenty of opportunities to work in any settings. And yes, we understand that there are limited seats, and there is also dearth of institutions that offer. So that's why I use this opportunity wherever there is a, now we have opportunity here, so you can utilize this opportunity and enroll yourself or nearby RCA institute. Okay, and any other queries? Alfifa, you have any query, you can use chat box. See, it depends on, yeah, if I do MSc in counseling psychology, then I can do private practice. Since there is no RCA license for counseling psychology, so is that I can do practice. See, basically, yes, you can practice in non-clinical settings, non-rehabilitation settings. There is no, permission required because those settings are not covered. But if you are working with clients with clinical, conditions, mental illness, then or with the disabilities, then definitely you need to work under a supervised clinical psychologist or a psychiatrist, so that the clients get proper treatment, and you are also devoid of any charges because of negligence or anything like that, or incompetency due to lack of training, professional training or so. Yeah, Alfifa, you can put in message. You all can select host and you can send your messages directly. And we request everyone to leave your details in chat box so that we can prepare certificates and send you. And also take a screenshot so that you remember. We will also send you a feedback form along with the course details so that you can contact us for admissions if required, and you can also share these details with others. Okay, then if there are no further queries, I think we can close this session. Yeah, Alfifa, you raise your hand. I think it's by mistake. Okay, then So we'll be closing this session here. So we'll be also sending you a feedback form. You remember your IDs, participant name, which is very much essential to map your attendance, and you will be getting certificate. Whenever there is a program, always join with your registered name and email so that it is easy to map your attendance and you can be issued certificates. So certificates will be updated on the website. The website link is available in the registration form. You can visit the website, or we'll also send you an email in a week's time with along with your certificate link from where you can download your certificates. There are various other programs also happening online. So you can visit the website and explore the website. We have a program coming up on 1st of August. So you can register for the program, which is organized by Department of Clinical Psychology in association with Apollo Hospitals. So we request everyone to register. It's a very beneficial course and useful course for everyone. Those who have children at home, those who want to have children, and and those every family will have a children, or every family has a person who would like to become mothers, or they are already mothers. So this is useful for everyone, and we have very experienced doctors, pediatricians who are coming and talking on August 1st. So we request everyone to join this session. So thank you, everyone. Have a great day. Take care.